Cell injury refers to the various ways in which cells respond to harmful stimuli or stress. It is important to distinguish between reversible and irreversible cell injury. In reversible injury, cells experience changes that can be corrected if the damaging factor is removed, allowing the cell to recover. Common examples of reversible responses include hydropic swelling, where cells accumulate excess water, and fatty change, characterized by the buildup of lipid droplets within the cell. When the damage is severe or prolonged, however, the injury becomes irreversible, ultimately leading to cell death. Irreversible cell injury occurs when cells are exposed to severe or prolonged stress, surpassing their ability to recover. This process often involves critical damage to cellular membranes, mitochondria, and genetic material. As a result, cells may undergo necrosis, characterized by swelling, membrane rupture, and inflammation, or apoptosis, a more controlled form of cell death. The consequences of irreversible injury include loss of tissue function and, in some cases, the initiation of disease processes. Understanding these pathways is essential for recognizing how various diseases develop and progress at the cellular level. Necrosis and apoptosis are two different forms of cell death, each with unique characteristics. Necrosis typically results from acute injury or trauma, causing cells to swell and burst, which often leads to inflammation in the surrounding tissue. In contrast, apoptosis is a programmed and controlled process where cells shrink and fragment without triggering an inflammatory response. The triggers for necrosis are usually external factors like toxins or lack of oxygen, while apoptosis is initiated by internal signals, such as DNA damage or developmental cues. Understanding these differences is crucial for recognizing how the body responds to cellular damage and maintains tissue health. Calcium influx and the generation of free radicals play significant roles in the process of cell injury. When cells are damaged, an excessive entry of calcium into the cytoplasm can occur, triggering the activation of various destructive enzymes such as proteases, phospholipases, and endonucleases. These enzymes degrade cellular components, leading to further structural and functional damage. Additionally, free radicals, especially reactive oxygen species, initiate lipid peroxidation, a process that damages cell membranes by attacking their lipid components. Together, these mechanisms contribute to the breakdown of cellular integrity and the progression of cell injury. Our bodies are constantly exposed to oxidative stress, which can damage cells and contribute to aging and disease. To counteract this, we rely on protective mechanisms involving antioxidants. Vitamins A, C, and E play crucial roles in neutralizing harmful free radicals before they can cause cellular harm. These vitamins work together to stabilize reactive molecules, support immune function, and maintain healthy tissues. By safeguarding our cells, antioxidants help preserve overall health and resilience. Ischemia and hypoxia both refer to conditions where tissues receive insufficient oxygen, but they differ in important ways. Hypoxia is a general lack of oxygen supply to tissues, which can occur even if blood flow is normal. Ischemia, on the other hand, specifically involves reduced or blocked blood flow, depriving tissues not only of oxygen, but also of essential nutrients and the ability to remove waste products. As a result, ischemic injury is often more severe than hypoxic injury. Additionally, when blood flow is restored after a period of ischemia, a process known as reperfusion, tissues can suffer further damage, known as reperfusion injury, due to the sudden influx of oxygen and inflammatory mediators. Necrosis refers to the death of cells or tissues in the body, and it can manifest in several distinct forms. Coagulative necrosis is most commonly seen in organs like the heart and kidneys following a loss of blood supply, where tissue architecture is preserved for a short time. Liquefactive necrosis typically occurs in the brain or in abscesses, resulting in a soft, liquid mass. Caseous necrosis, often associated with tuberculosis, produces a cheese-like appearance in affected tissues. Fat necrosis is usually seen in acute pancreatitis or traumatic injuries to fat tissue. while fibrinoid necrosis is characteristic of immune reactions involving blood vessels. Gangrenous necrosis, which can be dry or wet, commonly affects limbs and results from severe loss of blood flow, often complicated by infection. Inflammation is the body's response to injury or infection, and it can be classified as either acute or chronic. Acute inflammation is characterized by the rapid arrival of neutrophils, which are the primary cells involved in this early phase. In contrast, chronic inflammation develops over a longer period and is dominated by lymphocytes and macrophages. A distinctive feature of chronic inflammation is the formation of granulomas, which are organized clusters of macrophages that often arise when the body attempts to wall off substances it cannot easily eliminate. Understanding these differences helps clarify how the immune system adapts its response to various challenges. Inflammation is orchestrated by a variety of chemical mediators, each playing a specific role in the body's response to injury or infection. Cytokines such as interleukin-1 and tumor necrosis factor are crucial in inducing fever and promoting the recruitment of immune cells to sites of inflammation. Histamine and prostaglandins contribute to vasodilation, increasing blood flow and causing redness and warmth in affected tissues. Prostaglandins also sensitize nerve endings, leading to the sensation of pain, while leukotrienes are responsible for bronchoconstriction, which can restrict airflow in the lungs. Together, these mediators coordinate the complex process that define the inflammatory response. Laboratory markers of inflammation, like the erythrocyte sedimentation rate, or ESR, play a crucial role in medical diagnostics. ESRA measures how quickly red blood cells settle at the bottom of a test tube, with higher rates often indicating the presence of inflammation in the body. While ESR is a sensitive marker, it is not specific to any one disease and can be elevated in a variety of conditions, including infections, autoimmune disorders, and even some cancers. Clinicians use ESR alongside other tests and clinical findings to help identify and monitor inflammatory processes. Its value lies in tracking disease activity and response to treatment over time. Wound healing occurs through two main processes: primary and secondary intention. In primary intention, the wound edges are closely aligned, allowing for rapid healing with minimal tissue loss and reduced scarring. Secondary intention involves wounds with larger gaps or tissue loss, where healing relies on the gradual filling of the wound by new tissue. During both processes, collagen remodeling plays a crucial role as the body reorganizes collagen fibers to strengthen the healing area. Over time, this remodeling leads to the formation of scars, which may vary in appearance and strength depending on the healing method and individual factors. Angiogenesis, the formation of new blood vessels, is a complex process crucial for tissue growth and repair. Vascular endothelial growth factor, or VEGF, plays a central role by stimulating the proliferation and migration of endothelial cells, which line the interior of blood vessels. In parallel, fibrosis involves the excessive accumulation of connective tissue, often as a result of chronic injury or inflammation. Transforming growth factor beta, or TGF-beta, is a key mediator in this process, promoting the activation of fibroblasts and the deposition of extracellular matrix components. Together, VEGF and TGF-beta orchestrate the balance between tissue regeneration and scarring, influencing both normal healing and pathological conditions. Cells in the body can undergo adaptive changes in response to various stresses or injuries. Metaplasia is a process where one type of mature cell transforms into another type better suited to withstand a particular environment. Dysplasia refers to abnormal growth and disordered development of cells, often considered a precancerous state. Anaplasia is characterized by a loss of differentiation and cellular organization, typically seen in malignant tumors. These changes, especially dysplasia and anaplasia, are significant because they can indicate an increased risk for the development of cancer. Cancer arises from a series of molecular changes that disrupt normal cell regulation. Tumor suppressor genes, which normally act as brakes on cell growth, can become inactivated, removing critical controls. Oncogenes, on the other hand, are mutated forms of genes that drive excessive cell division. Many cancer cells also activate telomerase, an enzyme that maintains chromosome ends, allowing them to divide indefinitely. Additionally, cancer cells often exhibit the Warburg effect, favoring glycolysis for energy production even in the presence of oxygen, which supports rapid growth and survival. Carcinogens are substances or exposures that can lead to cancer by causing changes in the DNA of cells. These include chemicals like tobacco smoke, certain industrial compounds, and even radiation. In addition to chemical carcinogens, some viruses are known to play a significant role in cancer development. For example, the human papillomavirus, or HPV, is linked to cervical and other cancers, while Epstein-Barr virus, or EBV, is associated with certain lymphomas and nasopharyngeal cancer. Hepatitis B and C viruses, known as HBV and HCV, can cause chronic liver infections that increase the risk of liver cancer. Amyloidosis is a group of diseases characterized by the abnormal deposition of amyloid proteins in various tissues and organs. These deposits disrupt normal tissue structure and function, leading to a range of clinical symptoms depending on the organs involved. Pathologically, amyloid appears as amorphous, eosinophilic material under the microscope. A key diagnostic feature is its affinity for Congo red stain, which imparts a distinctive apple-green birefringence when viewed under polarized light. This staining property is essential for confirming the presence of amyloid in tissue samples. Hemodynamic disorders involve disruptions in the normal movement of blood and fluids within the body. Edema refers to the accumulation of excess fluid in tissues, which can result from increased hydrostatic pressure, reduced plasma oncotic pressure, lymphatic obstruction, or increased vascular permeability. It's important to distinguish between transudate, a fluid low in protein, and cells typically caused by systemic factors like heart failure, and exudate, which is rich in proteins and cells and usually results from inflammation. Hyperemia is an active process where increased blood flow leads to tissue redness, while congestion is a passive process caused by impaired outflow of blood, often resulting in tissue swelling and a bluish color. Understanding these mechanisms helps in diagnosing and managing various cardiovascular and inflammatory conditions. Thrombosis refers to the formation of a blood clot within a blood vessel, which can obstruct blood flow. The development of thrombosis is explained by Virchow's triad, which highlights three primary factors: endothelial injury, abnormal blood flow, and hypercoagulability. When a clot or other material travels through the bloodstream and lodges in a distant vessel, this is known as an embolism. Embolisms can lead to serious complications, such as pulmonary embolism or stroke. Shock, on the other hand, is a critical condition characterized by inadequate tissue perfusion, and it can be classified into several types, including hypovolemic, cardiogenic, distributive, and obstructive shock, each with distinct underlying causes and clinical features. Disseminated intravascular coagulation, or DIC, is a complex condition characterized by the simultaneous occurrence of excessive clotting and bleeding throughout the body. In DIC, the normal balance of the clotting system is disrupted, leading to the formation of small blood clots in the vessels, which can block blood flow to vital organs. At the same time, the body's supply of clotting factors and platelets becomes depleted, increasing the risk of severe bleeding. This paradoxical combination poses significant challenges for diagnosis and treatment, and can result in serious complications if not managed promptly. Understanding the clinical implications of DIC is crucial for effective patient care. Hemostasis is the process by which the body stops bleeding and repairs damaged blood vessels. It begins with the formation of a platelet plug, where platelets adhere to the site of injury and clump together to temporarily seal the break. This plug is then stabilized by fibrin, a protein that forms a mesh to reinforce the clot. Laboratory tests like prothrombin time, or PT, and partial thromboplastin time, or PTT, help evaluate different pathways of the coagulation cascade. Vitamin K is essential for the synthesis of several clotting factors, making it a crucial component in the proper functioning of the coagulation system. Major bleeding disorders affect the body's ability to form blood clots, leading to excessive or prolonged bleeding. Hemophilia A and hemophilia B are inherited conditions caused by deficiencies in clotting factors 8 and 9, respectively. Von Willebrand disease, another common disorder, results from a deficiency or dysfunction of von Willebrand factor, which helps platelets stick together and stabilize clot formation. In addition to these genetic conditions, anticoagulant drugs, often prescribed to prevent blood clots, can also increase the risk of bleeding by interfering with the body's natural clotting mechanisms. Understanding these disorders and their causes is essential for effective diagnosis and management. Fibrinolysis is the body's process for breaking down blood clots, ensuring that clotting remains balanced and does not obstruct normal blood flow. Central to this process is plasmin, an enzyme that dissolves fibrin, the main structural component of clots. Alongside fibrinolysis, natural anticoagulant mechanisms help regulate coagulation. Antithrombin acts by inactivating several clotting factors, including thrombin, to prevent excessive clot formation. Proteins C and S work together to degrade specific clotting factors, further maintaining the delicate balance between clotting and bleeding within the circulatory system.